Hi everyone, welcome back. My name is Dr. Yusra. I'm an aesthetic practitioner here in the United Kingdom where we focus on all things facial aesthetics, hair loss, and body contouring. And today I'm talking to you about menopause and skin aging. Menopause is a fact of life. It happens to all women at certain times of their life and at different ages, depending on a number of different factors. Menopause changes everything, including your skin. If you've noticed more dryness, more wrinkles, more sagging, more dullness, a little bit of anger, irritability, hair loss, well, you're not imagining it. I see this every single day. And I even conducted a study called Glowing the Distance to understand just how much menopause impacts skin health and psychological well-being. So what is the menopause? Menopause is when you stop having your periods for a period of 12 months. It's a retrospective diagnosis, which means after you've stopped having periods for 12 months, your doctor will diagnose you as having gone through the menopause. And when this happens, it's where your estrogen, your progesterone, and your testosterone, because testosterone is a female hormone too, significantly drops. And this directly affects a whole host of different physiological processes in your skin, in your body. Now, let's talk about when this actually starts, because a lot of people think that they reach 50 or 51, which is the average age of onset of the menopause in the United Kingdom, and all of a sudden they age overnight, their periods stop, and they have a whole host of symptoms. There's actually over 48 different noted symptoms of the menopause, and it's not just hot flushes. Lots of women come in and they say to me, I just cannot stand my husband at the moment. I don't want to go out. I am irritable. I'm really angry towards my children. I'm angry towards my partner. I have the insight, but I just can't control it. That's actually normal. And if more and more people knew that, I think it would save lots of relationships. And actually, I've published this data. It's available on my website online. You can download it. It's called Menopause, Glowing the Distance. And this report, you can download it from the website www.dryusra.com. Go on there, download it, read it, let your partners read it. It's an important one. Because what it also talks about is a period of life called the perimenopause, which can happen 10 years before the menopause. So it's not that you just age overnight, even though, yes, sometimes it can feel like that. What happens is a slow and gradual reduction of estrogen, progesterone, and testosterone, which actually starts to happen significantly from the age of 35. And you can start to get symptoms from your late 30s or early 40s, which include all of the symptoms that I've talked about and more. So if you are having irritability, low mood, you want to socially isolate, you've got brain fog, you've got recurrent UTIs, you have lost your libido, you're starting to notice sagging jowls, your skin is a little bit drier, you might have acne purges, or actually, you might have really dry, red, sensitive skin. You've got hair loss, you've got weight gain. You're not imagining it. This thing is real. And there are things that you can do about it. And that's the most important thing. The whole reason why I do the YouTube videos and the podcast is because I want to educate, to empower my patients to understand what's happening with their bodies, with their skin, with their face, and unapologetically access care where appropriate. So let's talk about skin changes. Now, one of the most important proteins in the body is collagen. Collagen is the most abundant protein in the body. And in your skin, it gives you structural support. It gives you structural integrity. It helps to improve the thickness of the skin. It helps to prevent lines and wrinkles. But as you're aging, because of the decline in estrogen is neuroprotective, protects your brain function, it's skin protective, it's cardioprotective, and it helps to protect your collagen. So you start to lose collagen. And you actually are losing collagen from around the age of 25 to 27 at a rate of 1 to 1.5% every year until you hit 35 to 40 and it starts to double and you're losing about 3% of your collagen every year. By the time you've gone through the menopause, you lose 30% of collagen in the first 5 years post-menopause. So this is significant. And this leads to the changes that our patients come in and complain about. So I have patients who come in and say, I don't know what's happened to me. I look in the mirror and I just don't recognize myself anymore. I've got lines and wrinkles around my eyes. I've got sagging of my upper eyebrow. I've got jowls. My skin is thinner. It might be breaking out or it might be really sensitive. My skin is really dry. And that's normal. That's a physiological process. The skin does lose collagen, so you're going to get more lines and wrinkles. Your skin is going to be drier because you have less oil production and you also have less hyaluronic acid. Hyaluronic acid is a polysaccharide, which is a sugar. It's also kind of like a sponge. It holds water in your tissues. So as you're aging, your skin becomes sensitive, it becomes red, the skin barrier weakens, making it more prone to irritation. And you have something called transepidermal water loss. So this means that if your skin barrier is not strong, you lose water more readily, which can exacerbate the feeling of dryness. But collagen and hyaluronic acid are not just there to make us look good. As much as we think that that's a function, it actually has a physiological function. Collagen is there to help with wound healing and remodeling and cellular functions like talking to each other, talking to the cells. Hyaluronic acid is also there for healing and for hydration of the tissues. So if you have less of these really important proteins and sugars in your skin, then you're going to have slower healing. But what also can happen is an increase in hyperpigmentation. When you are young, you usually have even skin tone, you have plump skin, you have hydrated skin, you have youthful looking skin. And as you are aging, your skin becomes a little bit less functional and the skin cycle starts to slow down. So usually in youth, from the moment a skin cell is born to the moment the skin cell reaches the top layer and dies and sheds is about 40 days, so 6 weeks. But as you're aging, that process of cellular turnover becomes slower and slower and slower. So it goes from being 6 weeks to 7 weeks to 8 weeks to 9 weeks. You can get a buildup of dead skin on the surface. But what can also happen is you can get hypermelanosis, which means that the pathway of creating hyperpigmentation can become exacerbated, leading to more melanin in the skin, more pigment in the skin, and you can get what we call age spots. Also, you can get more visible sun damage. People that are coming to see me now in their 50s with age spots didn't know what we now know. So they were sitting under the sun, they were sun tanning, they were using oils when they were younger, they were sitting under sunbeds. And the damage you do in your 20s shows in your 50s. There's a really slow trajectory of hyperpigmentation happening. You might get an instant tan, but sun damage is cumulative and it comes to the surface slowly but readily. And so by the time you're 50, you're postmenopausal, you're 60, pigmentation that used to be small starts to look like it's spreading. And that's just that you're getting more pigmentation coming to the surface. But the good news is that these changes are manageable with the right treatments. First and foremost, 80% of women reported a dramatic decline in their skin quality within the first 3 years of menopause. So this is not unique to you if you have undergone those changes. 70% of patients felt that their skin changes affected their confidence and self-esteem. Over 63% of patients didn't know that the perimenopause could start and the symptoms could start 10 years before the onset of menopause. That means as early as your early 40s, you can start to notice loss of firmness, dryness, increased wrinkles around the eye area, increased hyperpigmentation, jowling, hair loss, weight gain, and it resulted in patients wanting to socially isolate. Over 50% of patients said it impacted their confidence. But in my experience, my clinical experience, having worked with patients over the last 15 years, I can tell you that my reality, and it's anecdotal evidence, the reality based on my clinical evidence and my clinical experience is every single patient that goes through the perimenopause or menopause finds that she struggles with regulating her moods, okay? She finds the things that maybe didn't irritate her so much before become hyper irritating, sometimes starts to lose libido and finds her partner extremely irritating and has uncontrollable anger towards her partner. And why am I talking about this? I'm talking about this because I think both men and women need to know that this is normal. They haven't drawn the short end of the straw. And if you know that actually the girl next door is going to go through the same thing, then it will normalize these changes, but also it will empower connection and it will empower understanding. And I think it will safeguard lots of relationships. So going back to targeted treatments and why targeted treatments are crucial for maintaining healthy, youthful skin throughout the perimenopause and the menopause and postmenopausal. Let's talk about the best treatments to keep your skin glowing during the menopause. What actually works? There are a number of different, very effective treatments that I find are particularly helpful for my patients in menopausal skin. And these are no gimmicks, just science-backed solutions. First and foremost, let's talk about skin tightening and skin firming treatments. Now, when we age and when we're going through the perimenopause, the menopause, and by the way, even men have these changes. They go through something called the andropause, but that's for another podcast. What happens is there is a change in the actual physical structure of the face. So that's the skin, the superficial fat, the muscle, the deep fat, and the bone. So all 5 layers of the face are changing. And the changes include resorption or shrinking back of the bone, resorption or shrinking back of the deep fat that gives you kind of that structure and support, laxity of the muscle, and sometimes excess movement of muscle, which means that you're going to end up looking quite kind of tight in the lower face or getting lots of lines and wrinkles. Excess fat in the lower face, including the jowls and the submentum, so the double chin area, and skin changes. So it's important to understand these changes on a physical level. We call them morphological changes because they result in the changes that you see in the mirror. And you've got to address them at the source. If you just try to combat muscle laxity with lots and lots of fillers and fill your face like an eclair, you are going to look distorted. You are going to look unnatural. It is not a good look to be overfilled. Trust me, I have been dealing with this with patients who have been overfilled for the last 14 years. And unfortunately, they come in with pockets of overfilled areas in the mid-face, overfilled lips, because they have overused fillers to try and compensate for muscle laxity or skeletal changes or even excess fat. And you can't use filler to solve everything. So let's talk about the skin first and foremost. So the skin, in order to improve collagen, because you're losing collagen, you're losing elastin, you're losing hyaluronic acid, you need some kind of collagen stimulation treatment. And this can be a device-led treatment or it can be injectables. So let's talk about device-led treatments. Number one, radiofrequency. Radiofrequency is a treatment that uses heat-based energy or thermal energy to heat up the skin. And by doing so, that stimulates neocollagenesis. And we know that if you heat the skin to 41 to 42 degrees, you will get a process called neocollagenesis. New collagen will form. If you have new collagen, you're going to get thicker skin, you're going to get more plump skin, you're going to have better structural integrity, which in turn will diminish and reduce the appearance of lines and wrinkles. Number two, ultracell. What is ultracell? That is high intensity, focused ultrasound treatment. And this sends heat into the muscle, causing the muscle to tighten and contract. That's really particularly useful for patients who are starting to get kind of this sad appearance or nasolabial folds, downward turn smile, and it can create the image or kind of the feeling, the expression of sadness or anger. Because when you think about it, when you're drawing a sad face, you draw two eyes and a face coming down, right? So if the face is starting to get loose and heavy, then you're going to start to look a little bit sad. It gives off a negative expression. People often come and say to me, my children ask me why I'm angry. My children ask me why I'm tired. My children ask me why I'm sad, even when I'm not. That's because 80% of our communication is nonverbal. It's what our face is saying. Our face tells a story. And so these treatments are helping to change and improve the action of the muscles. So if we can tighten up those muscles, that is going to reduce the appearance of these kind of lines that go from the nose to the mouth or the mouth down that can make us look sad. The other treatment that I think is really, really helpful is EndoLift. EndoLift is a fantastic laser skin tightening treatment that can be used for lipolysis, which means fat reduction, as well as skin tightening. So what is it? This is a doctor-led treatment, so only a medical professional can do this. It's not a therapist-led treatment, and it is not suitable to be done by non-medically qualified practitioners. What it is an invasive laser that uses a long fibro optic that is delivered underneath the skin into the superficial fat, and depending on the settings, it can selectively melt excess fat, so it can emulsify fat by precisely targeting fat cells, and it can improve collagen production underneath the skin because the heat will stimulate fibroblasts, which lay down new collagen, so you get this kind of tightness over time. So it's a fantastic treatment. But it's got to be done right, because if you're removing too much fat, you can get laxity. So it's got to be done by a medical professional who's also quite artistic and understands what settings to use, and it's only as good as the person that's holding it. But of course, it's not equivalent to having a surgical facelift, okay? So these are non-surgical alternatives. It can be combined with liposuction for those who have excess fat in the double chin area, which can be a problem for patients who are postmenopausal. Now let's talk about radiofrequency microneedling. Now there's a whole host of different ones out there. There's Morpheus 8, there's Intracell, there's Silfirm, there's Secret Pro, there's Secret Duo. I really like the Cutera ones. They are very precise, they're gold plated, they're extra fine, which means minimal damage, minimal bleeding, minimal downtime. And what happens is a very controlled, very precise micro injury that is delivered to the skin at the same time as heat is being delivered to the deeper layer of the tissues. And this means you have a stimulation of collagen and elastin production, because what's happening when we create an injury is your body goes into wound healing response and it lays down new collagen that helps to improve wrinkle sagging and skin texture. And microneedling has been tried and tested for decades. It is a fantastic treatment to help to stimulate collagen. Microneedling can be done without radiofrequency for those who don't want kind of heat-based treatments or who are more maybe concerned about pain, because yes, radiofrequency microneedling can be spicy. Microneedling alone can help. You just need more sessions of microneedling alone. Microneedling, radiofrequency, turbo boost, microneedling. So these are tried, tested, clinically proven technologies that can make significant impacts for patients who have kind of loss of firmness to the skin and skin laxity. Let's talk about regenerative skin boosters. So what is that? These are treatments that are designed to wake up your skin. So as you're aging starts from the cells. So we know that the cells are actually aging. The skin cells are aging. They kind of become tired. They become less functional. They're not working as hard as they once used to. And inside every cell, you have something called the mitochondria. I'm going to try not to get too sciencey here, but the mitochondria are like the engine to the cell, okay? And they have their own DNA. And as you are aging, the mitochondria starts to become dysfunctional. It's not working as well as it used to, which means the cell can't perform like it once used to. And skin cells do a really interesting thing. When they age, they kind of just hang around and they start to tell the guys next door, the skin cells next door, to age as well. So they leak out negative messages and they communicate with each other. The skin cells literally talk to each other and they go, hey, I'm aging and I'm tired. How about you also switch off? It's the concept of rotten apple spread. And so regenerative aesthetic treatments are aimed at reducing these tired, switching off cells, which are also known as senescent cells, waking them back up again and stopping the leaking of negative messages, which can cause aging to spread. So we're literally regenerating the skin to heal and repair itself. So this can be a range of different things, which include poly-L-lactic acid, also known as Sculptra. It can include radiance, which is calcium hydroxyapatite. It can include PRP, which is platelet-rich plasma, or platelet-rich fibrin, which is PRF. It can include amino acid replacement therapy, and it can also include polynucleotides. All of these are different, and the end outcome of these treatments are all also going to be different. If you want the turbo boost, kind of the big guns, the Rolls Royce of collagen stimulators, then you're looking at PLLA, Sculptra, or calcium hydroxyapatite, which is radiance. These two treatments work in different ways. They kind of take a different highway, the M6 or the M1, to get to the same destination. They both will stimulate collagen. They both will improve new blood vessels coming to the area, and they'll improve elastin production as well, which means the skin is going to glow better. It's going to be more hydrated. It's going to be more elastic. You're going to have less lines and wrinkles. It's going to look tighter and tauter. And it's injected just below the skin surface. PRP and PRF are treatments that essentially almost fertilize the skin. So when you are injecting them, they wake up the collagen-making cells, the fibroblasts, to lay down new collagen. Polynucleotides, you have heard people call them salmon skin facials. They're not facials. They are injectables where little strands of DNA are extracted from salmon trout or salmon and are injected into the tissues, which can downregulate inflammation, great for patients who have rosacea, great for patients who have eczema, and can improve collagen production by inducing the fibroblasts to lay down new extracellular matrix. Amino acids. What are amino acids? Well, if you look at what collagen is made up of, it's actually made up of proteins, amino acids. And if you're a vegan or vegetarian or just not eating well enough, or you're aging, you might not have enough amino acids to create new collagen. So this is the nourishment that your body needs. This is the nourishment that your skin needs. So replacing the amino acids is really important alongside all of the other treatments. And so I often do a combination approach for my patients who want to improve their skin. Now let's talk about true skin boosters. You might have heard of Profilo or Skin Boosters by Restylane Vital or Bellatera Revive or Redensity One or Hydromax. There's lots and lots of different skin boosters on the market, and what they are small molecules of hyaluronic acid which are injected into the skin. And they don't stimulate collagen, so to speak, but they hydrate the skin. So they give the skin a glow. They literally replace the lost hyaluronic acid so your skin feels more radiant, it feels and looks more glowy, it feels and is more hydrated. So it's great for patients who have dry, thinning skin or loss of hydration. You might have these smoker lines around the mouth. You might start to get a little bit of crepiness, dryness, even around the eye area. These treatments are amazing. Now let's talk about volume replacement. So volume replacement requires volume to be injected. And this can be done surgically with fat transfer or non-surgically using soft tissue fillers. So these can be hyaluronic acid fillers. Hyaluronic acid fillers have been around for 25 to 30 years. What they do is they can be used to restore lost volume in the cheeks and in the jawline and in the lips and of course in the skin. And they come in different densities. So they can be thick, used to replace lost volume in the face, like used to replace bone. They can be used to reshape the nose. They can be used to improve the chin position. Or if you've got kind of a sagging jowls, they can be used to give you more definition at the jawline. So they're great for hollowing, volume loss. If you have dehydration of your skin, a fantastic treatment. It's got to be done properly and never think that more is more. Less is more sometimes. Use volume replacement only where you have volume loss. Number 4, anti-wrinkle injections. Now, what is that? This is probably the most common cosmetic treatment. Botulinum toxin type A can be used to temporarily relax overactive muscles that cause wrinkles. In doing so, they can soften lines around the eyes, around the forehead, and around the frown lines. And they can also, off-label, off-license, be used to reduce the downwards pull of muscles putting the face down, like the platysma, like the depressor anguli oris, like the mentalis muscle, which can give us this wrinkly orange peel or cellulite appearance in the chin as we're aging. So botulinum toxin is a great temporary treatment that can help with patients who want a cosmetic improvement to excess lines and wrinkles caused by overactive dynamic movement of muscles. Number 5, let's talk about the elephant in the room, which is weight management and fat reduction. Here is a reality of the menopause. Estrogen helps to modulate metabolism. And as we are aging, we are more likely to get metabolic dysfunction or metabolic changes. And that can also mean fat redistribution. So let's talk about the area that every single woman comes in complaining to me about. That is the abdomen. Pre-menopause, your abdominal fat is about 5% of your body weight. Post-menopause, your abdominal fat is about 20% of your body weight. So you have fat redistribution and patients start to get excess fat around the midriff or the mid-abdominal area. And it can really impact self-esteem. It can make you less confident in clothes. It can make you less confident in swim gear. It can make you less confident when you want to be intimate with your partner. And this is something I hear a lot that my patients say to me. And there are a whole host of things that you can do about it. Firstly, I think this whole podcast is about facing facts, talking about the realities, and also addressing and talking about what treatments can help. And of course, nutrition, lifestyle, diet, exercise is number 1 priority. But the reality sometimes is that women come in and they say to me, I am exercising, I am dieting, I just cannot shift the abdominal weight. Sometimes they want to go and have a surgical tummy tuck or be prescribed weight loss medication, which is appropriate where necessary if they are type 2 diabetic, if they are metabolically overweight, or they have obesity, where your BMI is 27 or above or 30 and above, depending on your background. Patients of Asian, Pakistani, Indian, or Arab background, if your BMI is 27 or above, then your risk to health is like a Caucasian patient with a BMI of 30 and above. So for those patients, yes, sometimes medical intervention is necessary. But again, diet, exercise is a non-negotiable because you are going to lose bone density and muscle density from top to bottom. So you've got to keep walking. You've got to keep building up your muscle. One of the treatments that can work is something called cool sculpting. Cool sculpting has been around for over 12 years. It is cryolipolysis. This means freezing the fat cells to minus 11 degrees, which eliminates stubborn fat deposits. Now, this is a medical treatment and it is permanent. Permanent means that once you remove the fat can't come back. Yes, you can still get enlargement of the remaining fat cells if you're sitting at home eating burgers, chips, and chocolate. But if you remove fat, be it surgically via liposuction or non-surgically using cryolipolysis, for example, once those fat cells are killed, dead, and removed, that's it in that area. And cool sculpting is a great treatment for those who don't want to have surgical intervention, who can't afford surgical intervention, who want to just have no downtime and sculpt their body and just get rid of the little deposits, the stubborn pockets like under the chin, the arms, the abdomen, the muffin tops or the back, and go straight back to work or straight back to their kids without any downtime. Of course, there are risks, and you've got to discuss that with your medical practitioner. When it comes to fat reduction, there are other options for patients that are not just cryolipolysis. This might be something like M-Sculpt Neo, which can tighten the muscle at the same time. I've done a whole podcast on that, so go and listen to that. It can also be Emerald Laser, which is a non-thermal, low-level light laser that can shrink the fat cells. So there are various options for patients, but know that there are options and you can unapologetically come in and discuss that with your practitioner. The other thing I want to talk about is hair loss. Androgenetic alopecia is exceptionally common, both in men and women. But in women, it can happen in the perimenopause, and it's one of those conditions that just gets worse and worse and worse. It's got a trajectory. Now, we see that 50% of the patients that we see who are postmenopausal have some extent of hair loss. And I would strongly suggest not to delay when it comes to hair loss. And the reason why is because once you get hair loss, the follicle from which the hair comes out can tighten and tighten until no more hair can come out. That is called sclerosis. Once that happens, treatments are off the table. There is nothing that we can do that can make the hair grow. But if you get in there early, you can wake up those hair cells, you can improve the follicles, and you can maintain the follicles. And that's really, really important because many women, including myself, feel that their hair is part of their femininity. And so if this is something that's important to you, please, please, please do not delay. We can nip and tuck your body. We can nip and tuck your face. You can have a facelift. You can have fillers. But once the hair is gone, it is so difficult to try and get it back. It's one of those treatments that I cannot emphasize enough that if you are starting to experience hair loss, get in quickly because you can improve it. But leaving it late means your treatment options are severely diminished and the treatment outcomes also severely diminished. So get in there early and start treatment ASAP if you do have hair loss. I hope that you found this useful. Menopause does not have to be scary. If you know what's coming, then you know exactly what you can do to walk into that phase of life feeling empowered and educated. And I think information and education is your superpower. Let me know in the comments if you have any questions, if you've ever had any treatments. Don't forget to like this video, hit the thumbs up, hit subscribe. Let me know what you want me to cover in the next video. And if you wanted to have a personalized skin plan or discuss any treatments, then please feel free to visit the website, book a consultation with one of our medical practitioners. We would love to help you go the distance.